People, in this video we want to cover this topic, gynecomastia. Gynecomastia means what? Female type glandular breast. See, mastia actually refers to breast, okay? So what is gyneco? Gyneco actually refers to female. So is it female breast? No, they are saying that it is glandular breast, which will be there in females, no, that type of breast, okay? It can be in males, mostly they are talking about males, but it can also be in newborns, which can be a female also, isn't it? So in this video we want to look at all the causes. So whom and all can it affect? It can affect both females, that is the newborn females, and also it can affect the males at different ages. So this glandular type of tissue should not be there. Breast will be there in everybody, that you understand, okay? Male, female, everybody has breast. Even men have breast. That's why men are also prone to breast cancer. But when this breast has glandular tissue in men or in a newborn, where the newborn should not have glandular breast, right? So if it has, then it is called as gynecomastia. So did you understand this part of it? Now understand that it sometimes it will be swollen because it has adipose tissue also, but if it is having fat, then we are not calling it as gynecomastia. So understand this, everybody has breasts, okay? Everybody has breasts, but this breast, if it has glandular tissue inside it, glandular tissue, okay, something secretory type, if it has inside it, then it becomes gynecomastia. But if there is a fat breast and inside it actually what is there is fat, adipose tissue, then it is called as lipomastia. In this video we are talking about the causes of what? This gynecomastia. Why does glandular tissue exist in people where it should not exist, like a newborn exists, etc., right? So are you understanding? Now this lipomastia, where can it be? It can be in obesity, okay? Lipomastia will be there in obesity. But here, are we here to learn about the causes of lipomastia? No, here we are there to learn about the causes of gynecomastia. So the main cause which has been written here, this is the main point that you have to write, okay? There is an imbalance between androgen and estrogen. Excess estrogen or androgen deficiency will cause gynecomastia, okay? So did you understand? This excess estrogen you underline off, okay? This excess estrogen only is the problem. Now this excess estrogen can be there in a newborn baby also, which can cause it to have gynecomastia. So please understand, this is not specific to men when we are talking about this, okay? So now let us look at the list of causes which cause the increase in estrogen or the decrease in androgen. So that is what is the basis of this. So we look at all the causes which increase estrogen or which decrease androgen. Got it right? Are you with me? Good. So first of all, let us look at the physiological causes of gynecomastia. The most of the gynecomastias you see will be physiological. Now what do you mean by this? So you have two types of gynecomastia. Gynecomastia is there and gynecomastia is there, okay? But there is something called as physiological gynecomastia and pathological gynecomastia. Can we use the word pathological? Okay. That means to say, in some places, if there is gynecomastia, it is normal, it is natural, it will be like that, and you have to reassure the patient that it's nothing wrong with the body, it is physiological. So now let us concentrate on the physiological gynecomastia, which is most common, okay? Are you with us, guys? Please focus. So the most common cause is physiological, and where and all will you see it? In three places you will see it: in newborn, in pubertal boys, and in elderly men, okay? So in newborn, like in this baby we are seeing, look at the breast. Basically the newborn has a female type of glandular breast. In fact, this baby is a female, but still see it has gynecomastia, and we are saying yes, it has gynecomastia though it's a female. Yes, why? Because it is not appropriate to the age, right? So it is physiological also. We are saying it's normal. Why? Because maternal and placental estrogens are causing this baby to have this gynecomastia. So once this maternal hormones and placental hormones recede, it should be fine. What do you say, people? That's why they're saying it is physiological, right? Nothing to worry, kind of a thing. So it can happen in newborn. Next, let's go to the next point here. Pubertal boys. So in pubertal boys, what they're saying is, before this testosterone reaches its level, the estrogen concentrations reach the adult level. Okay, in some people, the estrogen concentrations reach the adult level before the testosterone. So more estrogen can lead to this imbalance. This imbalance will lead to the breast glandular development. So that can cause gynecomastia. Okay. So what they are saying is this has to be reassured, but if it is not reducing, then you will have to investigate for the underlying abnormality. Okay, all that we will come to later. Now coming to elderly men. Now elderly men, what happens? There is decreasing level of testosterone. Okay, so obviously the estrogens will show their effect, correct? So are you understanding that this is something that you will reassure the patient that this is normal, okay? And this is physiological, it will happen. You have to reassure, and the patient has to accept. You have to reassure and make the patient accept that there is nothing wrong with them, okay? Now, let's move on. So physiological causes are over, people. Are you there? Now let us look at the pathological part of it. Please note, people, there are so many things that we will cover here as the causes. So just gear up, okay? So now there can be drug-induced. Now let us look at this drug-induced. Drug-induced, some of the drugs. So this is how gynecomastia looks. See, this is a male who is neither puberty nor an old age, right? Nor a newborn. So he's having gynecomastia. So this is what we will kind of focus on, okay? Because this is pathological, right? This is something which is not normal, right? So coming to the drugs which can cause, cimetidine used to treat acid reflux, but it doesn't look like it is in use that much. Digoxin, why would you take? Something to do with the heart. Inotrope. Cardiac glycoside, okay. Cardiac glycoside, they are saying it's an inotrope, positive inotropic effect it gives, okay. Then anti-androgens. So obviously this is so easy to understand. Anti-androgens, who won't understand this, right? You're giving something which will stop the androgen effect, like spironolactone. This is a diuretic, isn't it? Then cyproterone acetate, why would you take this? So they are saying that it is a treatment for prostate cancer. This cyproterone acetate. Cyproterone acetate. I will just break it up so that you can understand. Cyproterone acetate, treatment for prostate cancer. So I'm trying to understand some hormone imbalance it is causing, some hormonal effect. Spironolactone, potassium sparing diuretic, which you're using for treating heart failure, hypertension. Okay, so these two drugs, basically remember the person itself is taking an anti-androgen. So what will happen if he takes an anti-androgen? Estrogen will take over and estrogen will become dominant. So that is imbalance. So gynecomastia, okay. Probably, see, it is better to deal with gynecomastia than deal with prostate cancer, isn't it? So sometimes they do give this type of drugs. That's what I'm thinking. Coming to the next drug here, some exogenous anabolic steroids. That is from outside, you are taking some anabolic steroids into your body. Like diethylstilbestrol. This is a banned drug if I'm not wrong. This causes cancer. So basically it is banned because it was causing cancer in the daughters of mothers who had taken it during their pregnancy. They used to give this to prevent abortion or something. So basically this is an exogenous from outside. It is coming anabolic steroid, it is, right? So it's a steroid, it's an estrogen, it's a hormonal drug. So obviously estrogen is more. So you're understanding, right? So what will happen? What are we talking about? Gynecomastia. They're taking estrogen. How? In the form of diethylstilbestrol, which is banned actually now. Okay. Then cannabis, if they are taking, what does cannabis do? Cannabis. What is cannabis? They're calling it as marijuana. But what exactly does it do? Looks like if adolescent boys are having gynecomastia, they are keeping this one thing as a, thing, like, do they take this type of drugs kind of a thing? But actually what it is doing, that much of information is not there. But at least remember, okay, which are the drugs that cause a gynecomastia? Very easy, you will tell in the exam. Anti-androgens and estrogens cause. Yes, so you took anti-androgens. How did you take spironolactone or something else to solve prostate cancer? When did you take estrogens? Yeah, when I took some estrogen medication like diethylstilbestrol, which is not available, but at least you took some type of estrogen. Okay, I understood these two. Then what about the other things? Digoxin, yes, some cardiac glycoside and some cannabis, some drugs the person is using. Okay, good. So now we are done with drug-induced gynecomastia. We're going to go on. Like I told you, this is going to be quite a long video because there are a lot of causes of gynecomastia. So then we'll come to the next cause. We are going to discuss androgen resistance. That means these people have androgen, but they are not able to process it, looks like. AIS, androgen insensitivity syndrome also they are calling it as. So basically this person has the physical traits of a woman, but the genetic makeup of a man. This can happen because all his androgens are useless to him. He's not even able to use it. So androgen insensitivity or resistance syndrome. So the person looks like a female but actually is a male, XY he is, okay. So far, did you understand all the causes? Main cause they have blamed is estrogen. Why can it be more? In physiological causes we have seen. Then we have seen a drug induced. Then we looked at androgen insensitivity. Now we will look at estrogen excess. Again, it makes sense. Estrogen is more. Why is it? Why is it more? Some liver failure these people have. Oh. So what is happening? Steroid metabolism is only impaired. So basically, see, androgens are converted into testosterone, estrogen, everything. So some problem in this entire conversion looks like. Okay. Estrogen secreting tumors. This is a tumor of the testis. There is a testicular tumor. Please focus here. There is a testicular tumor. The tumor is secreting estrogen. So did you understand that could even be a tumor which is secreting excess estrogen? Then human chorionic gonadotropin secreting tumor. HCG secreting tumor of testis or lungs. So all these are some causes of gynecomastia. HCG, if it secretes, what will happen? Human chorionic gonadotropin, if it secretes, will it cause excess estrogen? So basically, human chorionic gonadotropin secreting tumor. This is a placental kind of a thing, right? This is a placental hormone kind of a thing. So instead of coming from there, it is coming from testis or lung, and it could be a tumor. So let us put these words in red. So there could be a tumor which is secreting all these estrogen. Okay, that's why this person has gynecomastia. Focusing people, let's move on. So you understood now androgen resistance can be there or estrogen excess can be there. Then there is something called as idiopathic. Nobody knows why it happened on earth. So simple. Just smile and say no idea. Okay. Then coming to the next important thing. We are looking at causes of gynecomastia. See, now we will look at this big topic, okay, hypogonadism. Guys, focus here. We are looking at this topic called as hypogonadism. In hypogonadism, the sex glands or the gonads are producing less hormones. So this hypogonadism is something. It's a generic topic. It can be there in everybody, male and female. But here we are focusing on the male. So in the male, if there is hypogonadism, then he can have gynecomastia. That is, his sex glands or gonads are producing less hormones. Then he can go into gynecomastia. Now, why is his sex glands not so active? Why are they not producing enough testosterone, let us say? So basically hypogonadotrophic hypogonadism or hypergonadotrophic hypogonadism. That means there are two types. The gonadotrophin is either less or more. So hypogonadotrophic hypogonadism or hypergonadotrophic hypogonadism. Now, why is there hypogonadotrophic hypogonadism? We are talking about the pituitary gland or the hypothalamic problem in the brain. So in the brain, you have something called as the hypothalamus and the pituitary, you know, right? The master and the master of the master. So this is controlling the sex organs, right? So there is some problem with the brain, the pituitary cause itself, some tumor, etc. Some problem, the structural problem with this part of the brain, or there's some inflammation there, or some congenital deficiency, some functional problem, or some head injury, or some, they're talking about various things. See, everything doesn't apply to gynecomastia here, but there is some problem with the brain, okay, which is causing this hypogonadism, which is leading to gynecomastia. And this hypogonadism can be because of the pituitary cause. Otherwise, it can also be because of some illness, okay, some thing which causes gonadotrophin deficiency. Okay, so they have given a lot of causes here. Not everything will lead to gynecomastia, but all of these can lead to hypogonadism. That you should understand. Okay, some diseases, not eating well, some kind of endocrine disease, etc. Then coming to hypergonadotrophic hypogonadism could be the cause of the hypogonadism. So not all of these can lead to gynecomastia, I am telling you, but the hypogonadism can lead to gynecomastia. Okay, so did you understand? We have tried to cover all the causes of gynecomastia from the brain to the gonads, what and all can affect and cause gynecomastia. Okay, so let us just finish off this video with some points here. Not a cause of gynecomastia. Prolactin excess, prolactin being excess, is not the cause of gynecomastia. Prolactin makes what? Milk secretion, isn't it? So that is not the cause, they are saying. Even if milk secretion hormone is more, it will not cause gynecomastia, they are saying. Okay, so in these people, what and all you'll check for? You'll check for testosterone levels, estrogen levels, prolactin levels, HCG to check if there's any tumor or anything. You'll check for LH, FSH levels, that is luteinizing hormone, follicle stimulating hormone. All these levels you will check to basically check the pituitary action, to check if there's any tumor, etc. Right? So basically in this video we have looked at the causes of gynecomastia. The point of this video was to look at all the causes. So gyneco means female type glandular mastia is breast. Okay, so basically gyneco refers to female. So female type glandular breast is what is the meaning of this. It can happen in females or males. Okay, so basically you will see it in newborns, and it can happen in males. Generally we're talking about all the causes we're looking at. So basically all men have breasts, remember, but if they have glandular breast, that is if they have glandular tissue in the breast, then it will become gynecomastia. So basically if it is adipose containing, that is fat containing breast, then it will just become a lipomastia, which you can see in obesity. But if it has glandular tissue, then it becomes a gynecomastia. So why does this happen? The main cause you should understand is because of excess estrogen and androgen being less, so the imbalance. So the estrogen is taking over and causing this glandular tissue to develop in the breast. So why does estrogen become more? It can be physiological. Please understand, it can be physiological, like in a newborn baby. This is a female baby which has glandular breast. So this is basically a gynecomastia case in a female newborn. So it can happen because of the maternal estrogen, okay, or the placental estrogen that is causing the newborn to have this kind of gynecomastia. Pubertal boys can have, before they hit that testosterone, they may have this estrogen which is more. So again, you have to reassure. Elderly men, as their testosterone levels decrease, they can have this gynecomastia because estrogens will take over. All the causes of gynecomastia we are looking at. So drug induced. So drug induced will be like digoxin, which is a cardiac glycoside. It can cause, please, are you able to see here? Then anti-androgens like spironolactone, you should know, remember, which is used as a potassium sparing diuretic for heart failure or hypertension. So spironolactone can lead to gynecomastia. Some drug, if people are taking, like cannabis, if people are taking, that can cause gynecomastia. So the things which are not used that much, like diethylstilbestrol, if people are using, that can cause gynecomastia. So we are making that as light gray because these are drugs that are not actually in use, isn't it? Like diethylstilbestrol not in use, and cimetidine I haven't heard of being used. Okay, then coming to androgen resistance syndrome. So these people have enough of androgen, but it is not working on them, right? So they have insensitivity or resistance to this androgen. So they may look like female, but actually they are XY. Okay. Then estrogen is excess. Obviously that is the whole cause of gynecomastia. Why does estrogen become excess? Because there is some impaired steroid metabolism. Okay, so because of liver failure, please remember such important words, liver failure, or there is a tumor which is secreting estrogen, or there is a tumor which is secreting human chorionic gonadotrophin, which actually has to be made by the placenta, you can understand, right? So it could be a tumor in the testis or the lung, remember, okay, tumor in the testis or the lung. Then it could be idiopathic. Always write idiopathic in the exam when they ask you, you don't know why it happens, right? So that is how we say. Then there is hypogonadism, which is causing gynecomastia. Hypogonadism means the sex glands or the gonads are producing less hormones. The production itself is less. Why is there hypogonadism? For that there are so many causes. Hypogonadotrophic hypogonadism, which is a type of hypogonadism where there's there is less gonadotrophin. Okay, it can happen because of a pituitary cause, a hypothalamic, that is the brain cause. Okay, so the hypothalamic or pituitary disease, it could be because of some illness in the person, right? Or it could be because of some deficiency of this gonadotrophin. Okay, then there's something called as hypergonadotrophic hypogonadism. See, there are a lot of causes for hypogonadism. Not all of them will lead to gynecomastia, but just remember that hypogonadism is leading to the gynecomastia. Then why is there problem with the hypothalamus or the pituitary? That could be because of a structural issue in the brain, or there could be some inflammatory cause, or there could be some congenital deficiency, or there could be some functional cause with the pituitary, or some other causes. Okay, so basically not all of these listed in here will cause a gynecomastia or a hypogonadism, but you can understand that gynecomastia as such is caused because of a variety of causes. And then you should also remember that prolactin being excess does not cause gynecomastia. So if the milk secreting hormone is more, it does not cause gynecomastia. It is not because of prolactin hormone they are saying. And when you test the person, you should always test the person for the level of testosterone, estrogen, prolactin, HCG, which could be because of the tumors of the testis or lungs. And it could also, you should also check for the luteinizing hormone, follicle stimulating hormone, etc. And you obviously will run all the tests, check for tumors. So Just one thing you focus on here, people. This hypogonadism can be because of Kleinfelters syndrome here. So this you elaborate in the exam, okay? So this person is not having any, so basically this person is an XXY. So XXY, what happens is he'll be sterile, right? Kleinfelters syndrome. Because he has 2 X and 1 Y. So this person will have hypogonadism, gynecomastia, okay? So this Kleinfelters you should focus on in the exam, okay? I need you to focus on this Kleinfelters. Then when we talked about liver failure, the cirrhosis of liver, hepatic cirrhosis, all that can be because of alcohol or whatever cause can be there, right? So all that you can mention here, alcohol, etc. So for gynecomastia, okay? So just focus on those 2 points more, okay? So that was about gynecomastia. So another thing, guys, this hypogonadotrophic hypogonadism, whoever has, the hypogonadotrophic, that is gonadotrophin is less. In that type of hypogonadism, all of them will have gynecomastia, right? I'm not saying in that all conditions can have gynecomastia, okay? So remember, if there is any pituitary disease, hypothalamic problem, or if there is functional gonadotrophin deficiency, that means functionally it is not working, right? Though it is there, kind of a thing. So illness, chronic illness, if there is Cushing syndrome, if there is hypothyroidism, primary hypothyroidism, if there is Kallman syndrome, that is isolated gonadotrophin deficiency, all this will cause hypogonadism, which will have gynecomastia. You understood, right? So this part of it is important for you for exam. So write Cushing syndrome, hypothyroidism, Kallman syndrome, pituitary causes, hypothalamic causes, illness, all that you write in causes of gynecomastia, okay?